ago, he had, well, when he was 16, he had they found a tumor on his brainstem, was causing hydrocephalus. At the time, and it's inoperable. At the time, he was fully functional. Had a drain put in so that it would drain the fluid and his brain's matter wouldn't be pressed up against his skull. Went for 10 years. He's a TCU grad, whole bit.
IQ 135.
Yeah, IQ about 100. Not kidding, 132. Smart kid. And 3 years ago, collapsed with, and found that the tumor on his brainstem had blown up from about the size of my thumb to about the size of a golf ball. It was a glioma, so it was supposed to be, non-cancerous, but something happened. So for the last 3 years, we've been working with him, doing TKM, essential oils, lasers. He's on a ketogenic diet, but the growth of the tumor 3 years ago basically caused a stroke, and that's why he collapsed for 6 weeks. He was in coma. So last year we got with Richard.
Did he been on the ventilator?
He had, well, he's gone through a couple of deals where he had fluid on the lungs, and so we had to take him into the hospital. He's had seizures, the whole gamut. I mean, it's an intense story. But was it about a year ago? We got with Richard and started to talk about picking up one of these because we found out about it through Biomodulator. What's that guy's name?
Well, through Dr.
Yeah, we knew about this through Dr. Tennant, but we started to look at different modes of this, and so we went with Avazia. And immediately picked up this, and the night Richard came over to show us the equipment, we had taken this piece, and John was having liver issues, if I remember right. And we just stuck it right there. And he was having pain here.
His pulse ox was 88.
And his pulse ox was 88.
On 2 liters.
Yep, yeah. And we got in right here. Actually, no. Did we stick it on the lungs?
We actually,
I can't remember exactly.
Yeah, what happened was I said, what are the worst 2 organs in the body? And at the time, you told me lungs and kidneys.
Yeah.
So we just, and John's chair, because of his condition with the atrophy and the stroke and the immobilization, actually leans back quite a bit. Right. So as I recall, we just took this and laid it here.
That's right. Yeah.
And then and because John's there, his IQ is 130 something, he was there, the body wasn't cooperating, right?
Yeah.
The atrophy was terrible.
Yeah.
His eyes were back in the head, and his ability to communicate was pretty much a grunt.
Well, yeah, he can kind of nod a little bit, yes or no he wants.
So it was limited. It had to be, I wouldn't want to be trapped like that. But nonetheless, and it would be, we can always edit this part out. Nonetheless, the medical community had told you to let him go.
After, in the hospital when he first collapsed and was in coma, they said there's nothing we can do. Take him home. He'll live for about 2 weeks.
Yeah,
that was that was 3.5 years ago.
So your mom and you rolled John's chair up to the table that we were sitting around, and so your mom, John, me, and you.
Yeah.
And we're talking.
Yeah.
With this on.
With this just sitting here.
Just sitting here.
And I remember you're right now. We set this here and just let it sit. We put a pillow on him and just kind of had it sit there, and his oxygen, he was on, you're right, it was like 2 or 5 liters, and he could not get his oxygen above 88. And we did that for like 20, 30 minutes.
I just remember it was about 20 minutes or so.
Yeah.
Your mom says, wait.
Let's go check the pulse ox.
I can hear John breathing.
Yeah.
We look over, and we can see the chest moving for the first time in ever.
Well, a couple of months. Well, he had been having some trouble for a couple of months at that point with oxygenation.
Yeah.
And
y'all realize
it was
that
95.
at 88 you can't get better.
Yeah.
Because you need the energy. Now we're back to the chart, right? You can't improve the voltage if you don't have things working.
Yeah. So we went had that, and we went from 88 to 95 in like 20 minutes.
We were 99 at the peak.
Yeah, and his
The peak,
oxygen was.
You could hear him breathing through the nose, and you could see the chest moving, and that was like.
And we've done this several. You know, we've had several issues because when you're that have that much disability and you're not able to move, your kidneys start to act up, your liver starts to act up depending on the diet, and you know we've got him on ketogenic, so it's quite intensive on his liver. So we'll do this when he starts to get a yellow kind of
the jaundice.
Yeah, around his face. We'll put this on his liver, and that'll go away in about 2 days. If we get the kidneys going, we'll do that alongside a kidney cleanse protocol, and usually that'll clear up in a day or two. And we just we use this kind of as a tool to kind of fight the little fires that are going on while we're working on the bigger issues. But ever since we've gotten this, we've had this on his back about 6 to 8 hours a day. We'll just turn it on, set the thing, and let it go. Just because, you know, why not?
Why not?
And so we'll have that either depending on where the issue seems to be that day. We'll have that in his lower back. If we feel like his kidney, we'll check his urine, and if it's discolored or starting to smell, we'll put that there. Or if we feel his lungs are more in need, we'll just slide it up the back and use it on the back. And it's been very effective. We notice it when we don't do it. You know, it's tough to tell because you can't really tell when you don't have something to gauge against.
Yeah,
when
things are good, who knows?
Yeah, who knows? But when things are bad, we'll set that up, and in a couple of days, usually it'll clear up whatever he's got green snot or something like that with this. And
on the stroke end, since everyone's going to want to know, you were using the G pulse primarily.
Yes. Yeah. So
in the beginning,
we've been because we didn't get that until recently. But yeah, we've been sticking that up against his neck. And I can say from last, I believe it was October, November when we picked this up, to now, his memory has increased.
Yes, that's a side effect.
Well, the stroke had taken out his short-term memory. He has his long-term memory. You can ask him, what was the 20th president of the United States? He can tell you. But if I ask him, what did I ask you a minute ago? He can't remember. So one of the effects is it went from, because we've been testing it, it's gone up from about 30 seconds, his short-term memory, to about 1.5 minutes, and continuing to increase. And we just continue to use it and continue to see results.
And where were you pointing that on the neck?
We actually we slide it in between the headrest and the chair, and we'll stick it right there, and just have it sticking right up against his neck. I'd like to see if we can find a way to actually mount it so I can put it somewhere, because I know that with a brainstem injury or with a stroke it's right up a little bit higher. Yeah.